Hi everybody, welcome to another video. Today's topic is a special requested topic. As per usual, you guys know that if there's something I'm seeing in clinical practice that needs to be addressed, we'll talk about it on this channel to clarify and give you guys a little bit more information about a specific topic. So today's topic is, what does it mean when someone has an autoimmune condition that actually is not identifiable? So it's almost like an unknown autoimmune condition. What does that mean? Oftentimes people come in and kind of the introduction to the practice is to do some functional medicine style blood work. Everyone loves blood work, myself included. It's a great tool to be able to identify and fully address what's going on in your tissues in depth. It often does yield some things for people that they're like, I've never been told this before. No one's ever evaluated this. This thing hasn't been addressed before. And so one of the things I always screen patients for, especially after everything going on lately in our world, is looking to see how your immune system is doing. There is a test that looks to see if the body is having any type of immune system dysregulation, usually autoimmune conditions. And one of the tests that we look at is something called an ANA, or anti-nuclear antibody. This is actually screening for a bunch of different auto antibodies in various immune system conditions. Really, it's looking for about 150 auto antibodies in conditions like, for example, Hashimoto's thyroiditis, lupus, SLE, drug-induced lupus, Sjogren's mixed connective tissue disease disorder. It's really looking to see how well your immune system is doing at not attacking itself. Our immune system should never attack itself, and oftentimes if it does, there's a driving factor and driving force behind this. And today I want to clarify and share with you what that thing is. So stay tuned. So if someone comes in and they have a positive ANA, we may do some additional blood tests as a next step to identify where is this coming from. Oftentimes when we go down the rabbit hole looking for additional tests, for example, double-stranded dsDNA antibodies, anti-Rho antibodies, anti-Smith antibodies, anti-parietal cell antibodies, anti-mitochondrial cell antibodies, a lot of times what happens is that nothing shows up. So it's almost like the person's having something with their immune system happen, but the full answer isn't there. And when this happens for people, the likelihood, or what's really probably going on, at least what I see in clinical practice, is unknown viral load. We all understand to some capacity that viruses create stress. They create damage to the way our immune system works. It kind of is like the immune system isn't getting the full signaling system in an appropriate fashion. And then that can cause problems for really a lot of different things. That can cause problems with how we're able to fight off colds and flus. Now, the interesting thing of people that have autoimmune conditions is that they're often not sick. They're not people that get sick often. They're like, I hardly ever get a cold. I hardly ever get flus. I really am not sick often. And it's paradoxical because those are my patients that oftentimes do have the more autoimmune conditions where it's secretly lurking behind the background. Now, the things that I find to be true for people is Epstein-Barr virus particles. A lot of people don't really understand how imperative and kind of critically significant it is to have viral load that's lingering in the body. Now, the herpes family of viruses causes a ton of problems for people. A couple things that are in that family, a couple conditions, if you will. Epstein-Barr virus, which is herpes simplex 4. That's the virus that causes mononucleosis, or the kissing disease, often when we're in our 20s. Cytomegalovirus virus is another virus that can create stress. Varicella zoster virus, which is another herpes virus. There's about 55 identifiable herpes viruses that create autoimmune conditions. So my point of today's video is that if someone comes in and says, I have a positive ANA and I've done the gamut of tests and I still don't know what's going on, likely your immune system needs to be addressed and your viral load has to be supported. And there's ways to do that naturally, right? There's a lot of different things that you can do enzymatically to support the immune system. We really take a broad spectrum approach when someone has something like this because by default, we're not just working with immune system stress, we're likely working with some cortisol imbalances as well. Cortisol is one of the hormones that keeps our immune system stagnant and not optimal. So cortisol is part of the sympathetic nervous system. It's actually coming out in high amounts when someone's having issues with stress modulation and kind of turning on and turning off the stress cascade. And what happens for a lot of people is if they are living in a chemical cocktail of cortisol, their immune system will drop by default. We all know from a general perspective that stress causes issues. Well, what's actually happening is partly that cortisol is out in a high amount, and that's dropping the immune system for a big percentage. Another factor too is people that are eating diets rich in refined carbohydrates and sugar, even fructose, which is fruit sugar. So diets high in fructose or fruit sugar also can affect the immune system, because what happens is the blood glucose goes up, and there is a direct correlation between blood sugar, aka blood glucose, and immune system stress or immune system problems. That's kind of like why people that are diabetic don't heal. We all know someone that's diabetic, type 2 diabetes, and they have issues with their immune system. Well, what's the correlation there? The correlation is that immune system is correlated to sugar consumption. So when someone comes in, as a backtrack, just to recap with you guys, with a positive autoimmune condition that's unidentifiable or doesn't have a specific thing, my thoughts are we dealing with viral load? Are we dealing with cortisol issues? And are we dealing with environmental toxins? Is this person exposed to things that's keeping their immune system irritated? Like, for example, mold and heavy metals. That's a very possible thing. Even parasites. These are things that are not conventionally talked about, but oftentimes will create positive ANAs or immune system stress. And in the functional medicine space, or in my world, we'd have to look at all these factors to see what's going on. It's not linear. You know, a lot of people, we have a reductionist approach to medicine in our culture of A plus B equals C. And unfortunately, when we're dealing with immune system stress, this is going to be a deep dive into looking at all of the inputs or impulses that are affecting immunology and really how your immune system's working, whether that be a Th1 response, a Th2 response, looking at things that are affecting your entire mast cell system, things like mast cell activation syndrome, looking at the lineage of certain white blood cells, your lymphocytes. Another thing that can happen too, and I want to just kind of share this with you guys, is that if someone has viral load, it can affect their white blood count and the red blood count. It can kind of alter the lineage of immune system cells that are produced in the bone marrow. That's oftentimes where we produce a lot of our immune cells. When we're younger, it happens in the thymus. When we're older, a lot of our immunity comes from our digestive system, and then our bone marrow liberates or produces cells that help us to fight. Sometimes if we're dealing with these unknown autoimmune conditions, we'll find lymphocyte cells or neutrophil cells, which are part of viral and bacterial infections, altered and skewed. We may even find a white blood count that's a little bit low or sometimes too high. People sometimes say, my doctor recommended a hematologist in these conditions. And really, the hematologist visit doesn't yield anything either. It's just we're dealing with stealth infections or unknown infections that are hiding behind the scenes. So if you're dealing with an autoimmune condition, my invitation to you is to work with someone that can help support all these different things to make sure that every area of your immune system is being supported, and really help to optimize that in multiple ways, because it's not a linear approach. It's actually pretty robust in terms of how to support you. So I hope that was helpful, you guys. As per usual, if you like this content, give the video a thumbs up and be sure to subscribe to the channel. Also, if you're not already following me on Instagram, please do. On myself on all platforms, Facebook, all the social media content platforms on myself, Dr. Elise Tercy. And what else can I tell you? That's pretty much it. And I hope to see you guys in the next video. If there's topics or suggestions that you guys have, of course, drop them down below in the comments. And if you have something like this that you know you're dealing with, drop a comment down below. I'd love to hear from you guys a little bit about what's been going on with your immune system, because we all know 2020 till 2022 is the year of health and immune system support. So I'll see you guys in the next video. Talk to you soon.